This is Nursing Australia, proudly brought to you by APNA, the Australian Primary Healthcare Nurses Association.
Welcome to Nursing Australia. I'm Nurse Robbie. If you have tuned into the podcast before, welcome back. If this is your first time, we are very excited to have you here on the Nursing Australia podcast. I am incredibly excited to be back hosting another episode. I think this podcast is so special. It is a chance for us nurses to take a moment out of our very busy days to check in with ourselves, learn something new, connect to other people by hearing about the cool work people are doing or the stories of other nurses around the country, and also just hopefully help us feel a little more on the pulse of what's going on in nursing and primary healthcare nursing in Australia in general. So I'm really excited to be back. I hope if you've tuned in before, you're really excited to be back as well. Or if it's your first time listening, welcome. I hope you're excited. It's going to be a really good episode. Today, we're going to discuss the almighty challenges posed by vaccinating the nation against COVID-19 and the vital role that primary healthcare nurses will play.
This will be the first time ever that we've had to do mass vaccination.
We discuss the tricky topic of recommended versus funded vaccines.
Whenever we're talking about any kind of healthcare, there's always financial considerations, and the governing bodies have to balance delicately benefit versus risk for our community.
We hear Jane's story, a nurse practitioner from Tasmania who started her own nurse-led clinic for people experiencing homelessness.
It really became clear to me in that moment that there was a problem here in Tasmania, and I resolved at that moment I wanted to do something about it.
And then finally, we hear some financial wellness tips and tricks for nurses. I am very excited for the wellness segment of this episode. I don't know about everyone else here, but I certainly didn't get into nursing for the money, so any tips and tricks around financial wellness are very much appreciated. But of course, as always, first, here is the news.
In this bulletin, a nurse practitioner earns the right to prescribe HIV medicines, nurses speak up for primary healthcare reform, infection control checks still lacking in aged care, and remembering nurses killed by COVID-19.
This is Nursing Australia News.
Hello, I'm Tony Wells. A nurse practitioner at Mount Isa in outback Queensland has become the first in Australia to be accredited for prescribing HIV medications. Dale Thompson is now certified to prescribe medicines for HIV along with medicines for hepatitis B and hepatitis C through the federal government's highly specialised drugs program. Mr Thompson said this meant that patients who needed these medications no longer had to wait up to 2 weeks for a specialist to come to Mount Isa. He can now assess these patients and write up a script for them straight away, making care more timely and patient-centred. Mr Thompson is based at the Mount Isa Sexual Health Clinic, part of Queensland Health's Northwest Hospital and Health Service. The voice of nurses and midwives was heard loud and clear at the latest consultation on the federal government's 10-year primary healthcare plan. APNA worked closely with the Department of Health on the consultation, creating a briefing paper for stakeholders and presenting as the peak body for all primary healthcare nurses. More than 30 key health stakeholders took part in the consultation, including representatives from the Australian Nursing and Midwifery Federation and the Australian College of Nursing. APNA is represented on the steering committee for the 10-year plan by our president and registered nurse, Karen Booth. Meanwhile, nursing groups have criticised the 2020 federal budget for lack of significant investment in primary healthcare reform. APNA President Karen Booth says the government has clearly been focused on its response to COVID-19, and she is hopeful that next year's budget will see more strategic investment that will enable primary healthcare nurses to play a greater role in improving the health of Australians. Ms Booth says APNA welcomes spending on nurse skills in aged care and is encouraged by the pilot programs on team-based care involving nurses in rural New South Wales, which she says will add to the body of knowledge already developed through APNA's nurse-led clinics. She says APNA will continue to work with government and other stakeholders on primary health reform so that the nurse role is better utilised. APNA will also be seeking greater recognition and support for nurse practitioners, plus permanent nurse access to telehealth beyond the 31st of March 2021. Similar criticisms were levelled at the budget by the Australian Nursing and Midwifery Federation, and the Australian College of Nursing, with the college calling out missed opportunities in the budget. Aged care experts have raised the alarm about a potentially deadly resurgence of COVID-19 infections in residential aged care facilities, as new data shows most providers are yet to receive a visit from the federal regulator. New figures provided to the Sydney Morning Herald and The Age show the Aged Care Quality and Safety Commission is yet to perform COVID-19 infection control checks on about 2/3 of providers nationally and half of those in Victoria. Labor's aged care spokeswoman Julie Collins said this showed the Commission, which did not receive any additional funding in the federal budget, doesn't have the powers and resources it needs to protect older Australians. And finally, overseas now to the United States, where the names of registered nurses who lost their lives to COVID-19 have been read aloud at a candlelight vigil outside a California hospital.
Madeline Johnson, 70, registered nurse, Burlington, New Jersey, passed away May 25th.
Each one of them, a life lost. Each one of them had somebody that loved them and cared for them.
Reverend Janelle Ablola, whose mother was a nurse years ago, spoke of the sacrifices and the hard decisions nurses make every day.
I don't think that they should be making choices between whether they should be able to live and work safely.
That audio courtesy of KGO TV.
It's been called the mission of the century, delivering a COVID vaccine to billions of people in hundreds of countries around the world. To provide global coverage of COVID-19 vaccines, 15 million deliveries and 15,000 flights will be needed across the various supply chain setups, according to DHL, the International Delivery and Shipping Service. Advanced planning is already well underway, not least because transporting the vaccine may present challenges. As COVID-19 vaccines have kind of leapfrogged development phases, temperature requirements of up to minus 80 degrees Celsius are likely to be imposed for some of them to ensure that they survive transportation and warehousing. That is a massive logistical challenge to the existing medical supply chain, which usually distributes vaccines between 2 and 8 degrees. I think most nurses, and especially primary healthcare nurses, are well aware of the 2 to 8 degree cold chain. Strive for 5, we know it well. Then, of course, beyond, bringing the vaccine in, keeping it in a warehouse, there's the challenge of administering it. Australia, isolated, large, hot, it just presents more logistical challenges. And primary healthcare nurses will be critical to the vaccine reaching those who need it most, and quickly. Raina McIntyre is a professor of epidemiology at the University of New South Wales.
This will be the first time ever that we've had to do mass vaccination. We're assuming that ideally everyone in the population should get vaccinated. And the last time there was mass vaccination anywhere in the world was with smallpox vaccine. And Australia actually didn't use mass vaccination. Australia relied more on quarantine and border control to keep smallpox out and had vaccination campaigns when there were outbreaks. So there's no one in the workforce today with living memory or experience of mass vaccination. And it's a much bigger undertaking than targeted vaccination, which is what we do now under the National Immunisation Program. And essentially, with these epidemic diseases that spread rapidly and increase rapidly over time, ideally you'd want your vaccination to be finished very quickly, within 2 to 3 months at the most. If it takes a year or 2 years to get everybody vaccinated because we just don't have enough vaccinators, then we'd be living with COVID for much longer. Yeah, so there could well be a lot of remote and rural communities where nurses are the only available vaccinators. So I think primary care nurses who are not vaccinators should think about doing the vaccinator course and getting accredited for vaccination.
Inez Rio is chairperson of the Northwestern Melbourne Primary Health Network, a doctor in general practice and experience in an area which has seen the bulk of COVID cases in Victoria. She says that the role practice nurses will play is enormous, from monitoring temperature control to talking to patients about the vaccine, of course to administering the vaccine as well. Nurses and doctors are also going to play an important role in allaying people's concerns about the vaccine.
Most of your primary care nurses will be working within a general practice setting or a community health setting, and I would say raise this issue amongst yourselves, amongst the GPs and you, and say, hey, do we have a plan for this? Even though we don't actually fully know what the requirements will be for cold chain, etc. On the premise that, perhaps it won't be very different, perhaps it will be quite different, but the idea is we will want to provide in the most effective and efficient manner this vaccination to our patients. How can we do that? So let's think about this now. What are we going to do? How can we scale up our time? How can we scale up our infrastructure? Who in the practice is interested in doing it? Who's not interested in doing it? Some of the nurses might choose now to do a nurse immunisation course, so that they're actually more fully credentialed to be able to do that. We don't, again, know what the criteria will be, but one would think that if you're a nurse immuniser over, if you've got that special sort of credential, you might be able to do it more independently within a general practice and community health centre. Right. And we can also anticipate that people will have more questions and that there will be more discussion. And there's already some, dialogue around that, and that's absolutely legitimate. And people need to be able to explore those issues.
One thing everyone can agree on: frontline health workers, like primary healthcare nurses, will be among the first to receive the vaccine. Primary care will be essential to be able to vaccinate people safely and quickly, and so strengthening that infrastructure will be key. We'll be back after this.
Primary Times is APNA's biannual magazine for primary healthcare nurses. Stay up to date with the latest news and features about the emerging trends in primary health, the vital role played by nurses in patient-centred care, and health policy updates from APNA. Our next edition showcases nurses leading the way in their communities across Australia, plus insights from some of the nation's most respected health leaders. Primary Times is an APNA member-only publication. The next edition will be distributed in the first week of November.
As nurses, we want to deliver the best evidence-based practice for every patient. When it comes to immunisation, this can be tricky because sometimes recommendations change, the evidence changes, guidelines change, and we often just look to administer the NIP or National Immunisation Program funded vaccines. And sometimes we forget that there are a range of recommended vaccines beyond those that are funded on the NIP that we should really be informing our patients about. But this often leads to tricky conversations with patients or with families about the concept of vaccines that are recommended based on evidence but aren't funded. And that kind of concept is often foreign to them and something that we have to explain. The meningococcal B vaccine is a really good example of this. To discuss this somewhat complex topic, I'm joined by 3 APNA superstars who can hopefully help me shine some light on it. There's founder Sam Moses, nurse and project officer Joe Millard, and APNA's new nurse educator, Suzanne Blackby. Thank you all for joining me.
Great to be here.
Hey, Robbie, good to be here.
Thanks for having us.
All right, so Sam, we might start with you. Can you just give us a bit of a high-level overview around what is meningococcal disease?
Invasive meningococcal disease. It can also be called IMD because, we love acronyms in this country. It's a rare but serious disease. Most commonly, it presents as septicemia and/or as well as meningitis. There are 13 known meningococcal serogroups, and they're distinguished by differences in surface polysaccharides of the bacterium's outer membrane capsule. The clinical manifestations of meningococcal septicemia and meningitis may be non-specific. So they can include, obviously, a sudden onset of fever, a rash. Now, there's about 3 different rashes there. There's a petechial rash, a purpuric rash, or a maculopapular rash, and they're all a little bit different in how they present. Headache, neck stiffness, photophobia, so that's, when light's a real problem, altered consciousness, muscle aches, Cold hands, extreme thirst, joint pain, nausea, vomiting. They're sort of the main ones. The characteristic rash of meningococcal disease does not appear. It actually, when you put gentle pressure on the rash, it actually doesn't disappear. It stays there, but the rash is not always present.
I was just thinking of when we see sick little kids that come in, and, you know, if we get like a really pale, photophobic little one come in, the mum's holding them and they're floppy, I mean, that's our worst nightmare, and we're really worried about them. So that's the kind of picture I get when I'm thinking of those, especially the little people.
You know, it's just really important to remember that any person who wants to protect themselves against invasive meningococcal disease can receive the MenACWY and the MenB vaccines from as early as 6 weeks of age.
Jo, can you sort of explain the difference? Because I know I have had patients who are kind of confused by this, as we sort of recommend vaccination to them and then they don't realize they have to pay, but then some people don't and whatnot. Can you discuss for the people listening sort of the difference between recommended and funded vaccines in Australia?
Sure, Robbie. So whenever we're talking about any kind of healthcare, there's always financial considerations, and the governing bodies have to balance delicately benefit versus risk for our community. So it's one of those things that we need to be aware of and inform our patients where they might be eligible for funded vaccines, but also let them know the cost and discuss those cost implications for them, so that they can be aware and actually plan for their care as well if they are not eligible and need to pay for their vaccines.
I mean, we're constantly learning as nurses, and we're trying to educate each other, and then we need to educate our patients, and immunisation obviously can become a bit of a hot button topic, and that, you know, they often have a lot of questions, you would hope. So and one information, what questions can primary care nurses ask families around immunisation for meningococcal disease?
Yeah, Robbie, I think, you know, the real standout, the important thing to remember here is the recommendations. That's where the science is at. That's where us as primary care nurses need to start. And meningococcal immunisation is recommended for any person who wants to be protected against IMD. So, and it can be given safely from 6 weeks of age. So that has to be the little thought bubble that's always there, I think. You know, we see lots of kids under 5 for their scheduled childhood vaccines. We see them regularly, we get to know them, we get to know their families. So those scheduled encounters are really, really great opportunities to ask the question. Did you want to know anything else about the immunisations that are available for your child at this age?
Does anyone have any other kind of tips or tricks around how to tackle that conversation with families or with people thinking about certain immunisations that might be recommended rather than funded, or bridging some of those knowledge gaps?
It can be tricky a conversation to have. It can be one of those challenging conversations. I'm just thinking back to the practice that I was working in, and there was a very well educated parent, and they were somewhat vaccine hesitant. So we had a conversation about the scheduled and funded eligible vaccines, and we had a nice program going there. And then we raised that there's actually recommended vaccines, so these are not funded. And so initially that person was quite hesitant, and they thought, well, you know, the government's told me I'm having these, so why would I need to be thinking about these other vaccines? And so what we did was we provided hard copy information. That person was really curious, so they really enjoyed going on the internet. And I said, look, here's a list of evidence-based resources. So I referred her to the Australian Immunisation Handbook, because the person was hungry for knowledge. You wouldn't do that with everyone, but this particular person wanted to know all the ins and outs.
Yeah, there's nothing like information and giving people the time to read it and absorb it. And sometimes you can even pull together your own little resource and, you know, pull the bits of really useful stuff from a whole different range of resources and put them together in a, you know, on one of the practices letterheads or something, and hand that out as well. I've done that with some things.
I used to find just being quite honest about what motivates a vaccine to become funded versus non-funded and actually make it more about data and sizes and cost burden of a disease, probably not using that language because it's maybe a little too technical, but really demonstrating to them it's not because the risk isn't there, it's because the risk versus the risk of the cost to the health system might not actually quite match up. And we're often the stewards of immunization in our clinics and our services. So it's nice to be able to chat about it and to upskill and to hopefully take this into our practice. Thank you all so much for the time.
Thanks, Robbie. Thanks for having us.
Excellent. Thank you.
Thanks, Robbie.
For healthcare professionals, there is a link in the show notes which will take you to an in-depth discussion on meningococcal disease and recommended versus funded vaccines. I would really recommend that if this is something you're interested in or that you deal with at work a lot, that you go and listen to this more in-depth conversation that we all had, because there were heaps of amazing insights and heaps of really good evidence shared. So I would very much encourage you to check the show notes out for that one. We'll be back after this.
This podcast is brought to you by APNA, the Australian Primary Healthcare Nurses Association, and is only made possible by our members. Join today. Google APNA membership.
Who has the time to wade through every piece of healthcare news? Primary healthcare nurses certainly don't. Fear not. APNA's Weekly Connect e-newsletter condenses key industry news into digestible content while serving up a feast of useful resources. Stay in the know and save time. Subscribe for free at www.apna.asn.au.
We all know nurses across the country, across the world, doing incredible things. And one of the great things about the Nursing Australia podcast is that we get a chance to highlight some nurses around the country doing really inspiring and really innovative things and sort of demonstrating the scope of the nursing profession and how broad that can be and how much care we can provide to people. And we have an amazing story to share with you today. Jane Laidlaw is a nurse practitioner from Launceston in Tasmania. In April 2019, she launched Mission Health in collaboration with City Mission and the University of Tasmania School of Nursing. Mission Health is a weekly nurse-led drop-in clinic providing free healthcare for Launceston's homeless and vulnerable. This is Jane's story.
So one morning I was driving to the gym in Launceston and I saw a car in the distance, and I thought this was most strange in the fact that the car park to the gym was far closer, and I happened to park near this car and I realised somebody was living in that car, and at that moment I was absolutely horrified because I was aware, as many people are, that in big cities, homelessness and sleeping rough is very overt, and you see people in the middle of city centres, and I didn't think that happened in sleepy, lovely Launceston. It really became clear to me in that moment that there was a problem here in Tasmania, and I resolved at that moment I wanted to do something about it. And I attended a nurse practitioner conference where the overarching theme was, where are there gaps in healthcare? And at that moment, it was absolutely clear that I needed to do something to help these homeless people and wanted to set up a clinic in Launceston. And I believed, how on earth can I make that difference? But with discussions with City Mission, who are part of Mission Australia, I was able to, with some support, set up a collaboration with the University of Tasmania to develop a clinic. So in central Launceston, City Mission is a charitable organisation that helps assist people with their welfare. So that would be providing them with food parcels, it would be providing them with assistance to acquire accommodation, employment, and those sorts of things. And this is to support the cohort of people that are really marginalised and are homeless or at significant risk of homelessness, or are perhaps couch surfing or something like that. And they had always wanted, and they really were aware that the missing link was some sort of health service. And when we approached them, they were absolutely delighted. And at the same time, 2 university lecturers at the University of Tasmania were also having similar thoughts, and they are both registered nurses, and they're from the School of Nursing at the University of Tasmania. So they also made contact, and it became obvious that a 3-way collaboration would be very useful in developing what has since become a clinic that we have been operational for the last 2 years. So the clinic has developed, and it is called Mission Health. And this has been developed to try and help support these clients, so the people who are very marginalised and are really voiceless in society. And it has become bigger and bigger over the last 18 months, 2 years. It has provided services such as wound care, general health assessment. As a nurse practitioner, I'm able to provide prescription medication. I'm able to order radiology, so x-rays and certain ultrasounds, as well as blood tests and urine samples, so the majority of pathology. And this has just meant that people who have no ability to pay for healthcare have been able to seek healthcare. This service is something that is purely provided for by myself as a bulk bill service. So that means that patients who have no access to funds or very limited access to funds can access some healthcare. So this clinic is held every Thursday morning. It has been developed as a drop-in clinic. This has been purely because we're highly aware that with this cohort of people, their lives are very haphazard and accessing appointments has been challenging, and this is a known fact in this group of people, and it's been really important that they can come and see people, and there are no time constraints. So they come to see us, and if they're in there for an hour, it doesn't matter. It's important that their needs are met on that day, wherever possible. It's absolutely my belief that this clinic can be replicated throughout rural and regional Australia, and does actually need to be. This is certainly from a humanitarian perspective at the very, very start, and it also is really because this group of people do have significant comorbidities. They've also got lots of chronic health problems. One of the most common things that we actually are aware of are things like mental health problems, and we do come across many other chronic diseases that can be COPD, chronic lung disease, that can be diabetes. But even when we look at something more simple as basic women's health care, you have ladies who have never had a pap smear, never had, or a CST as it's now called, but they've never had breast screening. So one of the things we did find that was an issue was that immunisation for this cohort was poorly accessed. And with there was an immunisation update, and I was sat there with some colleagues, and they said that those who are homeless or at risk of homeless should have a flu vaccine. Well, of course, that's very sensible, but they did say that it wasn't funded by the government. And I became very forthright about this, and at a break I went to tap the person on the shoulder from Public Health to say, look, this is what we've set up in Launceston. Surely there must be a way that we can access flu vaccines. And they said, this person said, oh, give me a few minutes. And a few minutes later, I had the tap on my shoulder to say I could have as many flu vaccines as I wanted for this cohort, which is just wonderful. And I think with this clinic, it does mean that you are able to advocate for people who are voiceless. And that is really, really crucial in my mind. And since that moment, I was then approached by Public Health, who had a glut of hepatitis A and hepatitis B vaccines, and I was offered them for this cohort, which meant we were able to provide vaccines for this group and against diseases that they would not normally be able to access, and there would normally be a cost to. This clinic is funded purely by the MBS item numbers that I can charge as a nurse practitioner. The 2 university lecturers are provided as part of a clinical placement that they can do as part of their role, so they continue to be paid. Consumables, well, of course, as we know, any clinic, even though it is just a weekly morning clinic, they can certainly add up, and we're all aware of nurses that these things can be quite costly. Initially, a practice was closing locally, and I was asked if I'd like some consumables from them, which I've acquired. And that was very generous of an organisation to provide those, but we have been able to access a couple of grants locally from Rio Tinto Bell Bay and also from Calvary, who provide private healthcare locally. But it is certainly something that we're just aware that to keep running such a service, we will need to access more funds, and that is all there is to it. So proud of this service. I, like many nurses, believed I was just a nurse, in inverted commas. Did I ever think I was going to be able to effect any change at all to people's lives? No. Am I proud of this service? Incredibly. All right, so if any nurses out there are thinking that this is something they could do or something similar in their own locality, I'm more than happy to discuss this through, and if they'd like to contact me through APNA, that would be absolutely fine. I didn't believe ever that I would make a huge difference, but I know I am now.
Thank you so much for sharing your story with us, Jane. That story is just the perfect demonstration of what nursing is all about. Providing health for all, free from judgment, free from stigma, recognizing that our scope is massive and that we can be really innovative with the way that we provide care. And that if you, as a nurse, can see a gap in healthcare delivery, of which there are so many gaps, especially for marginalized and vulnerable people, you might be the person to actually bridge that gap in healthcare and get something off the ground like Mission Health. I hope that story was inspiring for you as it was for me. Jane's story is also going to be featured in APNA's next Primary Times magazine, which will be in members' letterboxes in early November.
Nursing Australia, the podcast for Australian nurses working together towards a healthier Australia.
When we think of wellness, physical and mental health often come to mind, right? But financial wellness is just as important. Did you know in Australia, poor financial wellness causes more than $30 billion in lost revenue each year? $30 billion. And it leads to higher rates of presenteeism, low morale, and absenteeism in the workplace. Now, okay, 2020 has been big, obviously, right? Like, it's been big emotionally, it's been big logistically in terms of all the changes that we have to make. There's a lot of curse words I feel like I could use to describe 2020 that I won't, but beyond kind of all of that highly charged emotion, and just feeling a bit overwhelmed in general about our health and the health of the world, the devastation of both the bushfires and the pandemic have also left a lot of people feeling really overwhelmed and worried about their finances, which, of course, as we know, something like financial unwellness or worrying about finances can massively contribute poorly to our physical and mental health. That is why we are really delighted to welcome Tax Senior Associate Jacinta Bolzanello from Hall & Wilcox, who will share some insider tips and tricks that may help reduce your financial stress and improve your financial and therefore your overall well-being.
Okay, thanks for having me on today's podcast, Robbie, and thanks for asking me to speak about financial wellness. I think this is a really important issue. You'll want to have confidence in knowing that you're making the right financial decisions, and tax issues are a really big part of that. So today I thought I'd go over a few tax issues and tips, which hopefully can give you some information that is relevant and useful to you as nurses working in primary healthcare. So the first one relates to the federal budget, which was released earlier this month. So it's great timing. One of the big announcements was that there's going to be personal income tax cuts, which have been brought forward and will take effect retrospectively from the 1st of July 2020. So if you earn, for example, $60,000, then you'll pay about $1,080 less in tax this year. This means you might soon see an increase in your take-home pay to reflect those tax cuts, which is great news for us all. Another relevant announcement from the budget is around superannuation. So currently, if you move between jobs, you might find that your new employer automatically creates a new super account for you. But from next year, superannuation accounts will follow you. So you won't end up with 2 or even multiple separate accounts, which means double the fees and administration. There's also going to be an online comparison tool that can help you choose an account, which sounds like it could be pretty useful. The last tip from the budget is a bonus payment of up to $500, which will apply to people who might be on government payments like carers allowance, family tax benefits, the age pension, and disability support pensions. These are going to be paid out in 2 payments of $250 each, one in December this year and the other in March next year. Outside of the budget, I've got a few other tips to keep in mind. So if you've been working from home, especially if you're in Victoria like me, you might be able to claim a deduction in your income tax return for working from home expenses. The ATO announced a shortcut method in April, which is 80 cents per hour of work. That's the simplest method. However, there are other methods that you can use for actual expenses. So if you've purchased specific furniture or equipment, then other methods might be better for you and give you a bit of bigger deduction. Another tip, if you're paying for training, education, CPD sessions out of your own pocket, you also might be able to claim a deduction for those expenses. They'll need to relate to your current work activities, and keep in mind that if your employer is paying for them, then you also can't claim them. There are also other expenses, which as a nurse you might be able to claim, for example, uniforms, protective clothing, membership fees or union fees, overtime meals and professional indemnity insurance, and even some car expenses. So there's quite a lot that might be relevant. And I guess the message is just to keep this at the back of your mind. And if you do have those kind of things, hold on to those receipts. The last tip for today is if you've made a donation to a deductible gift recipient, then you might also be able to claim a tax deduction for that. So for example, you might have made a donation to a charity for the bushfires earlier this year. So again, just make sure you keep your records and receipts. On that note, I hope that you can take away something new from the points that I've gone over today. And if you're not sure about anything, please speak to your accountant or advisor. They'll be able to help you. Thanks again, everyone, for listening. Back to you, Robbie.
Thank you for your very wise words of wisdom, Jacinta. I know quite a few nurses, myself included, who could really benefit from more financial wellness, I think. So we really appreciate you being on the podcast. Of course, I do want to remind everybody listening that Jacinta's advice, which of course is golden, is actually also just general in nature. So it does not take into account your personal circumstances. So you should consider whether the information is suitable to your needs, and then where appropriate, seek professional advice. Well, that brings us to the end of another episode of Nursing Australia. Thank you so much for joining us. I hope you loved the episode. I hope you feel inspired, or that you've learned something, or you feel a little more connected to what's happening in the world of nursing around the country. Please don't forget to subscribe or follow on whatever platform you're listening to this podcast on to ensure that you don't miss our next episode of Nursing Australia. I'm Nurse Robbie. See you next time.
Nursing Australia, the podcast for Australian nurses working together towards a healthier Australia. For more information, please visit us at www.apna.asn.au. Thanks for listening to Nursing Australia.